It's my pleasure to introduce Aron Shoara from Toronto, came in from St. Mike's Hospital, University of Toronto, and Andrew Beckett is the principal investigator or supervisor. I think he collaborates with Christian Kastrup as well. Okay, Aron, please.
Good afternoon, everyone. I'm just going to activate the laser pointer. All right. Thank you. Thank you for the introduction and organizer for the opportunity. Today I'm happy to talk about this project that we are collaborating with Dr. Kastrup's lab, which is counterflow gauze. So trauma-induced bleeding and in either military settings or just non-military setting, is the number one cause of basically death. So 90% of all of these deaths is preventable by applying proper hemostatic treatments. Sorry, I got nervous a little bit. Current method is using conventional combat gauze as just to apply it, just to stop bleeding until reach the hospital, and then the casualties can receive the resuscitation. So in this method, we were trying to apply some self-propelling method, using tranexamic acid, which is, as I mentioned here, using this drug with the combat gauze, that it's creating the CO2 gas that is propelling the thrombin and gas into the injury vessels. So we wanted to test if basically these combat gauze would help actually with the survival rate, and we noticed that actually with the counterflow gauze here. Sorry. We were able to extend lower the death number, in animal pig models, and then increase the survival rate. And then we wanted to test when this tranexamic acid is applied on gas, has some systemic absorption. And we tested and we noticed actually it gives, just by applying applying counterflow gauze, it would give 10 microgram per ml, which is equivalent to 1 gram bolus injection of tranexamic acid, IV injection in patients. And also we tested and we noticed that actually drug is delivered, into tissue here, and it propels into injured tissue. And next we wanted to see for intra-abdominal trauma, where you cannot compress the injured, trauma. So how can we use that? And we use this method, with powder. We in a compressed, in this compressed tranexamic acid, we were able to using this catheter, using these pig models, we were able to inject it into intra-abdominal cavity, and that gas would actually compress show that it could compress the injured models. And so, in short, we were able to test, we showed that actually counterflow gauze enhances delivery of hemostatic reagents we used, thrombin and tranexamic acid, and we were able to show actually this delivery would give an IV, equal IV volume dose of tranexamic acid. And we showed that it's a rugged and robust method for applying, for preventing actual bleeding in either military or civilians in pre-hospital settings. And with that, happy to answer any questions. Thank you.
Can this be applied with other pro-hemostatic factors? In the past, maybe with thrombin has been successful, so a double
thrombin
whammy?
was used with TXA. We tested, here we used it here with, here's when thrombin is used versus when you have thrombin and TXA used. All right, thank you.